the spore form to withstand harsh environmental conditions. And in terms of whether it's gram-positive or gram-negative, how would you classify Clostridium tetani?
Gram-positive.
Okay. Any other opinion?
So the Clostridium tetani is it's a gram variable organism, but it has small gram positive features.
Exactly so. So Clostridium tetani is said to be gram variable. When we say gram variable, it means that it doesn't have clear-cut gram-positive features. Neither does it have a clear-cut gram-negative features. So it's neither gram-positive nor gram-negative. So it's classified as gram variable. But other references will classify it as gram-positive because the features are more skewed to gram-positive. But if we are actually taking everything in consideration, it's actually gram variable, but it has more gram-positive features. So some books will classify it as gram-positive, but it's gram variable. The other thing I also want you to know about Clostridium tetani is this organism is a toxin-producing organism. Aside the fact that we've established it's a spore-forming organism, it's an obligate anaerobe. It exists in two forms, vegetative form and the spore form. Then in terms of gram-positive or gram-negative, it's classified more as gram variable with more gram-positive features. So if you are looking at its ability to produce toxin, Clostridium tetani produces two main toxins. One of them is tetanospasmin. So tetanospasmin. And the other one is tetanolysin. So it produces two main toxins, tetanospasmin and tetanolysin. So for tetanospasmin, that is the main toxin that mediates the clinical symptoms we see in tetanus. So the tetanospasmin mediates the clinical symptoms we see in tetanus. The tetanolysin has no pathological role in tetanus. So when you look at the two toxins, the signs and symptoms we are seeing in tetanus are mediated by tetanospasmin. And this tetanospasmin is classified as a neurotoxin. So it causes damage to the nerves, the nervous system. So it's classified as a neurotoxin. So that's tetanospasmin. But tetanolysin, we said, doesn't have any pathological role in tetanus. It actually causes hemolysis. But you do realize that tetanus, there is no hemolysis. So in terms of pathological role, it doesn't have any pathological role in tetanus. Any questions up to this point?
Dr. Ishak.
Yeah.
So I read somewhere that for the tetanolysis, it contributes to the pathogenesis of Clostridium tetani by causing local tissue necrosis and to also facilitate the proliferation of the bacteria.
For which one?
The tetanolysis.
Yeah, so that's what I'm trying to explain, that the tetanolysin causes hemolysis. It also causes cytotoxicity, and these do not occur in tetanus. So they are the pathological effects of tetanolysin, but it's not in tetanus. So it doesn't have any significant pathological role in tetanus.
Okay, thank you.
Okay. Any other question?
So does it mean that if a patient is infected with a tetanolysin, it's considered a different condition other than tetanus?
So when you are infected with Clostridium tetani, what will cause the symptoms is tetanospasm. Currently, we don't know what tetanolysin is going to do in terms of disease condition, but we know that it can cause hemolysis, it can cause tissue necrosis. But what is actually going to cause in terms of a clinical disease, we don't know. We only know that what causes tetanus manifestation is the tetanospasm, not tetanolysin. Are you okay?
Yes, sir. Thank you.
Okay. All right. So let's move on to talk about the areas where you find this Clostridium tetani. Why do you think you find these Clostridium tetani in the environment? Why do you think you find them?
In the soil.
Yeah, so that is where you usually would find Clostridium tetani in the soil, predominantly in the soil. Aside the soil, any other place you can find Clostridium tetani.
Um, Animal feces.
Yeah, so it's found in the gut of animals. So it's found in the gut of animals. So once they defecate, it comes out through their feces. And basically, it will go back to the soil. Mhm. So the gut of animals and soil. So that is where typically you find these tetanus um, bacteria, the Clostridium tetani. Okay, so take note of this because it will explain why when someone step on a nail, they want to go for tetanus injection because these nails that we are talking about may have been contaminated with soil or they are lying on the ground and they stepped on it. And you know that that is where you find Clostridium tetani. But let me ask you, for Clostridium tetani, how would it exist in the soil? Will it be the vegetative form or the spore form?
The spore form.
Exactly, the spore form. Because there's oxygen in the soil. So because there's oxygen in the soil, it's harsh for the organism. So it exists in the spore form to withstand this harsh condition. But when it gets to the human, you are infected, your wound is infected with the Clostridium tetani. When it gets there, it can thrive as a vegetative form. Because these wounds are usually infected with dead tissues, which provides a good anaerobic environment for the Clostridium tetani. So that's how it exists in the soil. The other thing I want you to know about Clostridium tetani is the incubation period. So the incubation period is 3 to 21 days. So what this means is that when you are exposed to the Clostridium tetani, it will take about 3 to 21 days to start showing signs and symptoms of tetanus. So it tells us the time of inoculation to the time of symptoms. So that's the incubation period. All right, so that's a brief introduction about tetanus. Now let's move on to talk about the pathogenesis. What actually happens when you are exposed to the Clostridium tetani and the spores? So what happens is that once you are exposed, the common exposure is maybe you stepped on a nail, you had a cut from a sharp object or something, and you want to go for tetanus injection. You are going for this because there's an exposure, and that exposure is because there's a break in skin. So whenever there is a break in skin, for which reason you've developed a wound, and that wound becomes contaminated with maybe soil, what happens is, under favorable condition, the organism, which is Clostridium tetani, is able to grow into the vegetative form. And once it grows into the vegetative form, it releases the toxins that mediate the signs and symptoms we see in tetanus. So I'm taking it again. Basically, it starts with an exposure. So the exposure could be in the form of you having a cut, you having to step on a nail. So when there's a break in skin, for which reason you've developed a wound that has been contaminated with these sharp objects. You want to go for tetanus injection because if you don't get treated under favorable conditions, so the Clostridium tetani may be existing as a spore in the soil, and that sharp object have been contaminated with the Clostridium tetani spores. So if you stepped on a nail, what happens is the spore of the Clostridium tetani can grow into the vegetative form under favorable conditions. And the favorable conditions is what we've talked about when you have no oxygen. So during anaerobic environments, so usually when you have dead tissues around the wound, it provides a good anaerobic environment for the Clostridium tetani to thrive. So there's a change from the spore to the vegetative form. Once the vegetative form is formed, it releases the toxins that mediate the signs and symptoms we've talked about, the tetanus plasmin and the tetanolysin. And we've established that it's the tetanus plasmin that causes the signs and symptoms we see in tetanus. So the tetanus plasmin is able to travel along the nerves. So basically, we said that the tetanus plasmin is neurotoxic. So what it does is it's able to inhibit the release of inhibitory neurotransmitters such as GABA and glycine. These are inhibitory neurotransmitters to help you relax. But the tetanus plasmin is able to inhibit the release of these inhibitory neurotransmitters. So if you don't have GABA and glycine that are necessary to help you relax, what happens is the excitatory arm is upregulated. Once the excitatory arm is upregulated, the spasms and there's rigidity. And that's what we see in tetanus. So the spasms and rigidity we are seeing in tetanus is because we don't have any inhibitory neurotransmitter like GABA or glycine to keep the excitatory neurotransmitters in check. So you have glutamate, you have all the excitatory parameters or neurotransmitters causing an increased spasms and rigidity, all because the tetanus spasmin has inhibited the release of the inhibitory neurotransmitters. So we said under favorable conditions, the organism is able to thrive, grow into the vegetative form, and this vegetative form is able to release toxins, tetanus plasmin, tetanolysin. So the tetanus plasmin is what mediates the signs and symptoms we see in tetanus. And we are also saying that tetanus plasmin inhibits the release of neurotransmitters. Basically, the inhibitory neurotransmitters GABA and glycine. So if you inhibit the release of these neurotransmitters at the nerves, what happens is the excitatory neurotransmitters are upregulated, causing spasms and rigidity. That is seen in tetanus. So the tetanus spasm, so let's use a typical example. Maybe you stepped on a nail. When you step on a nail, what happens is the organism is able to gain entry to the body through the site of injury. Once it gets to the site of injury, the organism changes into vegetative form and releases the toxins, tetanus plasmin, tetanolysin. This tetanus plasmin is able to travel along the nerves by a kind of transport system we term retrograde axonal transport. So retrograde axonal transport. What this means is that you got exposed to the tetanus plasmin from stepping on a nail, but the tetanus plasmin is able to travel along the nerves by a transport system known as retrograde axonal transport, meaning that it's traveling backwards and it's traveling to the CNS. You know, the CNS is made up of the brain and the spinal cord. So that's where the tetanus plasmin is traveling to. And because these are backwards, it travels backwards to the brain and the spinal cord. And that is what we call retrograde axonal transport. So retrograde means backwards. Axonal means along the nerves. So that's the type of transport system exhibited by tetanus plasmin. So what we are actually seeing as signs and symptoms is not because of the organism, but because of the toxin that is released, the tetanus plasmin. It travels along the nerves to the CNS. Once it gets to the CNS, we start to see the typical manifestations of tetanus. So the lockjaw starts, we may have the rigidity and all that. It starts with the lockjaw. That's usually the first sign you see when someone is infected with tetanus. Then it moves to other signs and symptoms. So the lockjaw starts and it travels downwards. So it travels backwards to the CNS, causes the lockjaw. After the lockjaw, it causes other manifestations peripherally. So rigidity, you may have spasms occurring and all other symptoms follow. So that's how the tetanus plasmin causes the symptoms we see in tetanus. Any question?
Sir, please, I don't really understand the backward movement you were talking about.
So you stepped on a nail, but the signs and symptoms are not starting at the site where you stepped on a nail. So the rigidity, the spasms wouldn't start at where you stepped on a nail. So it was around your leg, but the symptoms wouldn't start there. The symptoms will start with lockjaw, and that's because the tetanus specimen has traveled from the site of injury to the CNS. So if you picture your leg and you picture where your head is, you are traveling backwards to the CNS. So that's retrograde, backwards. And axonal is along the nerves. So that's the retrograde axonal transport. Once it gets to the CNS, it starts causing the lockjaw we see and other manifestations.
All right, thank you.
Okay, any other question? Okay, so basically that's the pathogenesis of tetanus. So a brief summary, there's an exposure by maybe nail puncher or something, stepping on a nail. There's the introduction of the Clostridium tetani, and once it gets into the body under favorable conditions, it changes into the vegetative form. And we are saying the vegetative form is able to release toxins. We mentioned two toxins, tetanospasmin and tetanolysin. And we said tetanospasmin is what mediates the signs and symptoms we see in tetanus, whilst tetanolysin doesn't have any pathological role in tetanus. And we said that once the release of tetanospasmin is able to travel the nerves through the by a term called the retrograde axonal transport. So it travels backwards to the CNS. And once it gets to the CNS, it can cause the signs and symptoms we see, the lockjaw and other symptoms. And basically what we said is that tetanospasmin blocks the release of inhibitory neurotransmitters, GABA and glycine. Once GABA and glycine are not being released to keep excitatory arm in check, what happens is there's upregulation in the excitatory neurotransmitters, and that causes the symptoms we see, the spasms, the rigidity, and all that. So essentially, that's how the symptoms occur in tetanus. Okay, so let's talk about the clinical manifestations when you have tetanus. So what are some of the signs and symptoms you expect to see?
Lockjaw.
So lockjaw, which is trismus. So that's the technical term for lockjaw, trismus. And that's the first, usually the first sign you see in tetanus. What again?
High body temperature.
Okay, so you may have fever. You may have fever. What again?
Increased heart rate.
Okay, but not
Seizures.
all patients will have that. So aside the trismus or lockjaw, what again?
Vasospasms.
Yeah, so the lockjaw we are seeing is because of spasms of the muscles around the jaw, specifically the masseter muscles. So the masseter muscles around the jaw, when you have spasms of the masseter muscles, that's when you feel like the jaw is locked. You tell the patient to open their mouth. They are finding it difficult to open their mouth because of the spasms of the masseter muscles. Aside that, you can also have generalized spasms. So it may not just be masseter muscles, but generalized spasms all over the body. So that could also be one of the clinical presentations. What again?
Opistotonus.
Yeah.
Yeah.
So we could also have opistotonus. So opistotonus. And what is opistotonus?
The stiff back, and then sometimes some of them like arc their back.
Yeah, so basically, if you picture how an arc is, so the back is arched. So they present with an arched back. So picture a patient who is lying in bed, but because the back is arched, the back of the patient is not touching the bed. What is touching the bed is the leg and the head. So you look at the head, which is touching the bed. The whole back is not touching the bed. The next part, which is touching the bed, is the heels of the leg. So that's in a form of an arc. So it's not a full circle, but an arc. So that's opistotonus. And that's because of rigidity occurring at the back. So the muscles around the back, there's sustained rigidity that is causing that the arc back we are seeing in tetanus, opistotonus. What again?
We could also have rhizus sardonicus.
So rhizus sardonicus. So rhizus sardonicus. So basically, rhizus sardonicus, the patient will present with a mocking smile. So the patient is smiling at you. At the same time, it seems they are mocking you. So that's what we call the mocking smile, rhizus sardonicus, or the sardonic smile. So that's also one of the clinical presentation of tetanus, and it's because of the spasms of the facial muscles. So because of the facial muscle causing the facial muscles, it will appear as if the patient is smiling and at the same time mocking you. So that's the mocking smile. Any other?
Sometimes they can have laryngospasm.
Yeah, so you can have spasms around the larynx too as well. So the patient may present with dysphagia, with difficulty in swallowing because of the spasms occurring there. So there's locked jaw, which can cause difficulty in swallowing. Then around the pharynx too, you could also have spasms there. So they could also have difficulty in swallowing. Okay, what again?
Another sign is we could also have autonomic dysfunction where there will be hypertension and tachycardia rotating with hypotension or bradycardia.
Exactly. So autonomic instability can also occur in tetanus. So when we talk about autonomic, we are looking at both the sympathetic and what parasympathetic. So you may have some sympathetic symptoms like hypertension, tachycardia, and parasympathetic symptoms like hypotension, bradycardia. So you may have alternating sympathetic and parasympathetic symptoms. So that's autonomic instability. And they may also present with sweating as well. All these are autonomic instability signs and symptoms. So these are the common signs and symptoms we expect. So trismus or the lockjaw, they could also present with rigidity, where they appear very stiff. Then dysphagia, difficulty in swallowing. Tetanus, where they present with an arched back. Then autonomic instability. So these are the things you want to look out for when you suspect someone has tetanus. And when you have these three, there are these three clinical signs and symptoms, we term tetanic triad. Once these signs and symptoms are present, it confirms tetanus. So you call it the tetanic triad. So which of the symptoms are classified as tetanic triad?
Trismus, Rhizus sardonicus, and Endopus tetanus.
Exactly so. So when you have trismus, so patients with lockjaw, they also have opistotonus, which is the arched back, and they have Rhizus sardonicus, which is the mocking smile. Once you have all these three present, we see the patient has a tetanic triad, and this confirms tetanus. You don't need any other lab or any other test. Once you have these three present, it's classified as tetanus. Any questions?
Sir, please, what if we have a situation whereby maybe the patient comes with only one of the child symptoms coupled with other symptoms? What do you like? How would you think around it?
Yeah, so we'll talk about differential diagnosis. So there are some differential diagnoses you should always keep in mind when you want to diagnose tetanus, because tetanus is basically a clinical diagnosis. You don't really need any test to confirm tetanus. There is the signs and symptoms and the history and examination. So because of that, you should know some key differential diagnoses so that you can differentiate tetanus from other conditions that will mimic tetanus. So we'll talk about the differential diagnosis after the types of tetanus. So let's talk about the types of tetanus. Then we come and talk about the differential diagnosis. All right, ask your question.
Please, for the complications, could fractures be one of them as a result of, let's say, the like fractures of, let's say, like the long bones, like the femur and like the femur?
Yeah, so that would be a complication. But in terms of signs and symptoms, it's not because of the tetanus directly that you are having fractures, but it's because of the sustained spasms you've had from the tetanus. So that would be a complication. So it shouldn't be captured under signs and symptoms we expect.
Okay, thank you.
Okay.
Hello, sir.
Yeah,
Sir,
good.
sir, please, when you were explaining the part of it, you said that there's an exposure, maybe through a cut or something, and then they get exposed to the bacteria. So is there a situation where someone can be presenting with all these things, but there will not be any cut? Maybe the cut has healed or something, but will still be having the symptoms, like no open wound. or there should always be an opening, like of a wound?
Okay, so that will also be captured under the diagnosis. So when we are talking about diagnosis, we talk about how to diagnose tetanus. So it's not every wound that you tell the patient go and take tetanus injection. There are some wounds that are termed tetanus prone wound. So we would talk more about tetanus prone wound.
Okay. Sir, please, the second one. Sir, please, I've seen an adult with tetanus who was kept in a dark room. And they said we shouldn't put on the lights. And I wanted to know whether it was like a symptom, like they're afraid of light or something.
Okay. So what you need to know about the symptoms of tetanus is the spasms that occur in tetanus tend to be mediated by too much exposure to sunlight, too much exposure to noise, if you have excessive touch. All these can precipitate the spasms we are seeing in tetanus. So when there's too much exposure to noise, all these are stimuli. So noise, touch, and also sunlight. So because of that, they are isolated from the general ward into a side ward. And the purpose is that for the general ward, you have a lot of noise, there's too much sunlight, anyone can come and touch you. But if you are put at the side ward, you alone in a dark room, you are prevented from excessive touch and noise. So unlike other infectious diseases, like if you get TB, they are isolated from the general ward because TB is contagious, can be transferred from one person to another. So it's an infectious disease which is contagious. That's why we are isolating you from the general ward. Unlike tetanus, tetanus is not contagious. The only reason we isolate you is because the symptoms are precipitated by exposure to light, touch, and also too much noise.
Okay, thank you.
Okay. Any other question? Okay, so let's talk about the types of tetanus. So what are some of the types that you know? Types of tetanus. So we are looking at the clinical types of tetanus.
Generalized, neonatal, localized, and then cerebral.
Okay, so we have four main subtypes of tetanus. So you have the generalized tetanus, you have the local tetanus, you have the cephalic tetanus, and we have the neonatal tetanus. So generalized, localized or local tetanus, cephalic tetanus, and neonatal tetanus. These are the four clinical subtypes of tetanus. So we take them one after the other, then we talk about them. So for the generalized tetanus, looking at the name, what do you think will be happening in generalized tetanus? What do you think will be happening in generalized tetanus? So basically, we are looking at the manifestation. So when we say someone has generalized tetanus, what it means is that the spasms in tetanus would affect almost all parts of the body. So all parts of the body can be affected by the spasms. So if you see spasms and the patient has lockjaw, there's sardonic smile, which is spasms of the facial muscle. They are also getting spasms on the hands, the legs. That's a generalized tetanus. So it's affecting almost all parts of the body. And this is the most common type of tetanus. So of all the types, the most common type of tetanus is the generalized tetanus. And it's also the severest form of tetanus. So in terms of severity, it's the severest form of tetanus. It's also the most common type, and it affects almost all parts of the body. So that's that for generalized tetanus. For localized tetanus, so from the name, localized or local tetanus. So the spasms that occur in localized tetanus are just at the site of entry of the organism. So if you stepped on a nail and you got that entry into the body, the spasms will occur just around the area of entry. So around the area of entry, around the leg, that is where the spasms will be localized. So you realize that the hands may not be affected. Maybe the left leg is not affected. It's only the right leg or only the right foot. That's a localized tetanus. So it's localized at the point of entry of the organism. And what you need to know about localized tetanus is, if it's not managed, localized tetanus can potentially change into generalized tetanus. So it may have started as localized tetanus, but if you don't manage it, it can cause generalized tetanus, affecting almost all parts of the body. So that's more of an immediate complication that can occur. Localized tetanus can progress into generalized tetanus. So that's the difference, localized and generalized tetanus. For cephalic tetanus, this is more of a subtype of localized tetanus. It's a subtype of localized tetanus, just that the spasms occur around the head. So when we say cephalic, cephalic means the head. So the spasms is occurring just around the head. So if you got maybe an ear infection, which was not managed well, and you had tetanus exposure through the ear, you are likely to have spasms occurring around the head. If you got pricked by, say, a needle, or someone cut you with a knife around the head area, it's likely that the spasms will occur around the head. So it's basically a subtype of localized tetanus, but the spasm is located around the head region. And usually it's because of proximity. So you know that once there's exposure, the tetanus spasm will migrate to the CNS. And once the exposure is around the head, and that's where the CNS is, the spasms usually will start around the head. So that is cephalic tetanus. And this can also be very, very severe because the progression is fast. So when you look at the incubation period, I mentioned incubation period is 3 to 21 days. This incubation period is dependent on the distance or proximity to the CNS, because the tetanus specimen will travel from the site of injury to the CNS. So if someone got maybe a cut around the head and someone who stepped on a nail, the one who got a cut around the head is likely to start showing the signs and symptoms faster than someone who stepped on a nail, because the incubation period is dependent on the distance or the proximity to CNS. So the more you are close to the CNS, the faster the signs and symptoms will start, compared to someone who stepped on a nail. The distance will take quite a long time. So that's why the range is wide, the incubation period, 3 to 21 days. So within 3 days, if it's around the head, the symptoms may start. But the one who stepped on a nail, it may take about 2 weeks, 20 days, 21 days before you start showing signs and symptoms. So that's the difference. And the last subtype of tetanus is neonatal tetanus. And basically, from the name, it affects neonates. And this is usually from mother to child. So the neonate or the newborn baby is likely to get tetanus if the mother was infected and didn't treat it. There can be transfer of the toxin to the baby. Aside that, when the baby is born, the umbilical cord, which is connecting the baby to the mother, will be cut. If they cut the umbilical cord and around the area of cut, they don't sterilize it well with antiseptics and all that, it can be infected and the patient can develop neonatal tetanus. Or even the instrument they are using to cut, if it's not sterilized and there are spores of Clostridium tetani, it can be introduced into the neonate and the patient can develop neonatal tetanus. With the advent of new antiseptics and new techniques of going about cutting umbilical cord, the neonatal tetanus cases seems to be rare nowadays, but that is how a neonate can also develop tetanus. So these are the 4 clinical subtypes: generalized, localized, cephalic, and neonatal tetanus. Any questions? Are we okay?
Can the cephalic lead to the generalized?
Yeah, so the cephalic can also lead to generalized. So it's just like a localized tetanus, but it's affecting the head. Just that it will start from there, but it can potentially spread to all parts of the body.
Yes, please. Thank you.
All right. Any other questions? Okay. I think we would have to end here. The next time we meet, we'll talk about the differential diagnosis, the diagnosis and management. Then we also do some questions on tetanus. And that will be the end of tetanus. So you go through the differential diagnosis, you should always know the diagnosis, the management. Then we'll go through some questions on tetanus, and that'll be the end. So if there are no questions, we'll end today's meeting. Have a good evening.
Thank you.
Thank you. Bye.